And we are recording. Okay. Oh, sorry, y'all.
Got back problems after this weekend, huh?
All right, yeah. Woo, this weekend. Let's not talk about this weekend. Hey, y'all. Welcome back. This is... Hi everybody, welcome back. I am Dusty Lion and this is Hopeful and Victory Talks. If you haven't already, please subscribe to my channel down at the bottom below. I'm not sure which side it's gonna be on, but be sure to do that. And then also follow my Instagram page and my Facebook page at Hopeful and Victory Talks. And today I'm here in Springfield and we're actually gonna be talking about the Getting to Zero action plan here in Illinois. So before we go ahead and begin, I'm gonna let my friend introduce himself and then we're gonna go ahead and start with a dab of that coffee because you know we can't start without some coffee.
Hi, I'm Chris Wade with Illinois Public Health Association, IPHA, and I'm a prevention lead agent for Illinois Public Health Association.
Let's go ahead and do a dab of that coffee. Bing! And if you haven't seen the theme that we're going to be talking about is getting to zero. And what that means is Illinois has created an action plan. We're going to go ahead and just talk about what it is in its totality, if you will. So Chris, tell us what getting to zero is.
So, okay, let me clarify a little bit. So getting to zero for the state of Illinois is our way of, you're hearing nationally and federally, ending the epidemic.
Okay.
And so what we've called it here in the state of Illinois is getting to zero Illinois by 2030. And what we mean is, of course, we know that there are going to be some transmissions. We're looking at functional transmission, zero functionally when we're talking about that. We know that there's still going to be some transmissions, but we really want to reduce that. Now, what is the getting to zero?
Yeah, what is that?
Illinois, basically what it is we want to bring together everyone in the field of HIV, including doctors, clinicians, nurses, emergency departments, prevention, everyone.
Working together in harmony.
To start screening and testing everyone for HIV. We really want that to happen. So that's including, regardless of what you may appear as or how you present in the doctor's office, we want the doctors to screen you for HIV. That's the only way we're going to get to know who really is out there that's living with HIV and doesn't know it. Because currently we know that there's approximately 1 in 7 people living with HIV that don't know it.
Wow.
Don't know their status. And on top of the testing, we also want to make sure that folks are getting prescribed and have access to pre-exposure prophylaxis, which is PrEP.
Yep.
So you hear a lot of the P, little r, capital EP, that's PrEP, pre-exposure prophylaxis. So we want to make sure that eligibility and people are accessing that, even though we know that right now, a lot of people aren't accessing it and aren't getting it. Are people like myself living with HIV and making sure that we get virally suppressed. So there's a lot of people out there who maybe have access to treatment, maybe don't have access to treatments for HIV that are not getting virally suppressed. And understanding that there are those who won't be able to be virally suppressed simply because of their resistance to certain medications or on their last regimen of HIV medications and have simply exhausted all other alternatives. So we have to be careful about that language, about making sure we get everyone virally suppressed, because we just know that there are going to be some populations across the HIV spectrum that aren't going to be able to get virally suppressed.
But do you think that this plan can really set the tone to get everyone who is not linked into care? In what ways are we kind of tackling some of those communities that don't have the resources to necessarily tap into the potential of this action plan?
Great question. So first I want to encourage your viewers to go to GTZ-Illinois.hiv and look at how they can volunteer and get involved.
Yeah.
They will also be able to see the work plan and how we're going to roll out this strategy. First and foremost, we need people at the table. That's the only way this is really going to happen, is getting people at the table that are youth, people of color, specifically talking about Black and Latino, men who have sex with men. I'm also looking at cisgender women. We're also needing transgender folks. We're needing gender nonconforming folks, or those that don't identify on the binary spectrum of their sexual identity. But that's the more people we can have,
bring
the
it
more
all in.
Bring it all in. We need more people at the table. Seriously. And with relation to your question on PrEP, I think if folks go to PrEP, P-R-E-P, the number 4, Illinois.com, they can find out resources on how to get on PrEP and where PrEP is available in their location, in their geographic location in the state of Illinois.
All right. Okay. Yes, what he said, because I'd be off. I'm clearly off. So PrEP is accessible. It's free, actually, here in the United States, so people can access
There's certain programs, yes.
Certain programs that would allow people to access this medication for free, correct?
Yes, they can get the medication pretty much largely for free at no cost.
All right.
Through either Medicare, Medicaid, state insurance programs, or through private health insurance. Will also offer it. So essentially the medication itself is free. What most folks find challenging is that copay or out of pocket when it comes to the medical office visit or the labs. However, in the state of Illinois, we've got resources to help you out with that.
Ooh, because that was actually one of my questions. Because I'm like, even though you're able to access PrEP, like as a person living with HIV, like you had to consider labs, like the cost of labs, the cost of the testing that's done to see where your liver levels are at and things like that, so that the medication...
Make sure you're still negative.
Yeah, and make sure, right, that too, so he can get you the right treatment. But like just that cost needs to be considered. So what are the resources that can help people?
So definitely visit the prepforillinois.com website. They can help you navigate some of that. But also there are health departments across the state of Illinois that have grants from Illinois Department of Public Health to offset your bills. So if you do incur bills for your medical office visits or for your labs, take those bills down to your health department, and you can find that on the prepforillinois.com website, or reach out to one of your local prevention agencies, HIVcareconnect.com, and find out what are the prevention agencies in your area so that you can get help and assistance in identifying who's offering offset of cost when it comes to the medical office visits and the labs.
That is a huge help. Like this past year, there has been so many challenges that I have encountered because I don't have a case manager. I decided not to go down that route. I'm handling everything by myself, but of course when you do that, you take on more responsibility. So this website, all the tools and resources that are available to you is like at your fingertips. So if you just have time, just go and like play around with it. It's hella colorful, which is kind of like nice. But on top of that, there's just so many things that you can just go into a rabbit hole and be like, oh,
and
like damn.
That's why I really want to encourage folks, look at the HIVcareconnect.com website, find out who the prevention agents are in your region or in your neck of the woods, because they actually have navigators, someone that can help you navigate so that you're getting the right information and the right resources geared towards your needs.
Looking at the action plan, I saw that and I'm just like, wow, this is a lot. How are we going to talk about this? But I think what's intimidating about it is just to see how vast this plan is. But what's so empowering is to see that there is a plan to address this concern, to really try to set a tone and a precedent for future generations. And I think this is a great step. We now have a map on where to go. We now have the tools that we can utilize, but at the same time, not everyone has those tools, but we're able to use those tools to kind of branch out and collect those people and to bring them in and be like, hey, we got this going. You should be a part of this because it's gonna help you and it's gonna help everybody else. So that's kind of nice that we have this roadmap here. I want to go ahead and actually start with the 6 key areas that the actual action plan denotes. So what do those 6 areas mean for the action plan and for the people living in Illinois?
When we talk about getting people tested, we talk about getting people on PrEP, we talk about getting people virally suppressed. Well, of course, there are going to be folks that have just fallen out of care for whatever reason and maybe got tested and never came back for their results, or just moved and weren't able to find another HIV specialty provider or a doctor. So surveillance is really key for those populations. So they're the ones, when we talk about looking for folks, to get them re-engaged or linked back into care.
We want you back.
We want you back. It's important to get linked in because largely, when we talk about ending the epidemic, it's key for people living with HIV to get virally suppressed because, of course, HIV can't be spread without someone living with HIV transmitting the virus.
Yep, you got to get into care. We need to get you to treatment.
Viral suppression, those are the means to really kind of, curb that. But, it's really key for people living with HIV to get involved in this process and know what we can do, what our role is.
No, but what if people who are like, if I'm living with HIV, which I am, like don't have the transportation to or the resources to get involved and to get the help that I need to maybe change my behavior. So maybe I'm having unprotected sex and I know I'm positive and I'm still having unprotected sex. Like that's like my little bit of like where I get into like the circle in my head and I'm just like, oh God, like syntax error, where it's like, hey, I'm HIV positive, I'm having unprotected sex, but I'm afraid to go get treatment and help because the stigma and the isolation that I feel. But the isolation and the stigma, it kind of is perpetuated through the laws or perpetuated through some of the information that's circulating out there. So how do I, who don't have the best behavior, get the best behavior and get the help that I need so I can start helping myself and helping my community? It's sort of like that weird circle that I haven't been able to break.
I think most folks living with HIV have experienced that.
Yeah.
Particularly early on in our diagnosis, the fear, the stigma, the shame, the guilt, all of that weight carried on us. I think the most important thing is getting into care. Get into care. And in Illinois, like I said, if you're living with HIV, HIVcareconnect.com is your starting point to get you back into care. Once you get back into care, then start talking to your case manager. Start talking to a peer about some of these things that you're challenged with. We all tend to suffer from what I tend to call terminal uniqueness.
Ooh, what's that mean?
Meaning that we're the only ones dealing with it.
Okay.
When we're really not. It's just getting it off your shoulders and talking to someone and really recognizing that, other people are sharing the same thing. You mentioned transportation. If transportation is a barrier, make sure you bring that up to your caseworker. Any barriers to your care and your treatment, your caseworker or your peer that works there, we call them peer navigators.
Hey, peer navigators, we love y'all.
They're called community health workers.
We love y'all too.
So reach out to those folks and let them know what are your barriers and what is it that you need to overcome to make it better for you to stay linked into care, to get the benefits fully of care.
So it's really just starting that dialogue really with your peer navigator and saying, hey, I'm having this issue. Can you help me out with this? And that actually is a very unique thing to identify. Terminal uniqueness is what you said, right?
So we tend to suffer with that. Some of us think that we're in something and we're in it alone.
Yeah.
And we're the only ones facing it. And the truth of the matter is we're really not. Someone else has been impacted or understands that process too. So our journeys may feel unique, but they may really be just
so now
we talk about and explore more.
I'm gonna pry a little bit. So how did you break that? Like how did you kind of get out of that terminal uniqueness? Since we all, and I agree with you, we all have experienced that at some point in our diagnosis early on. Like how did you find yourself realizing, hey, I want something better for myself. I want to help myself.
Right, and a lot of my story has to do with drug use, homelessness, finding myself in a rehabilitation center that actually catered to people living with HIV, dealing with substance abuse. So it created a space for us to talk openly about living with HIV and chemical dependency, which is rare and far and few between. Most spaces only want you to address the addiction piece, and privately and one-on-one we'll talk about HIV. But I was blessed to have an environment where we were able to talk about that openly in group settings and really kind of deal and tackle with that. Homelessness the same way. It's talking about that. Yeah, there's some shame to a lot of that, but really to put that beyond you and to move past it, even if you're currently active in substance use, or if you're wanting to remain homeless, there's still some things that you can exercise to keep yourself healthy. We want the best for you because there's a lot of services for people that may have substance use issues. We may have some services for homeless. There's a program called HOPA, Housing Opportunities for People with AIDS. These are programs that are specifically for people living with HIV. So there's resources out there. Sometimes they go untapped, and more people know about it, the more availability of services.
Yeah, because then they don't fall to the wayside. We increase the funding for them. We keep them flowing. So really, really, just keep watching this video. There is so much information that is going on.
Talk about link conditions. When we look at link conditions, we're looking at things like hepatitis C, comorbidities, as we like to call them in public health, sexually transmitted infections, gonorrhea, chlamydia, syphilis, large within our population.
It's on the rise, FYI.
Human papillomavirus virus, is also huge within our population. So looking at link conditions and what can we do to also kind of address HIV and those other conditions within that strategy. So we're looking at things like, the cure for hepatitis C is available. Making sure that folks know that there is a cure for that.
So it's like, not only are we talking to you about your HIV testing, but hey, how about you come get a urine test and we can test you for other things as well. So kind of like making a combination out of that that testing of just your overall health, not just.
And it's interesting you just mentioned urine tests. Most people think, particularly living with HIV or depending on your lifestyle, sexual orientation, and your sexual behaviors, most people think for STIs, pee in a cup, pee in a cup.
Is it swab now?
Well, we want everybody to swab. We want you to do an oral swab. We want you to do a rectal swab and a vaginal swab if necessary. But all these are repositories of diseases. So we want to make sure that you get everywhere checked. So depending on your sexual behaviors, you may not detect it in a urine sample. So get that swab, and we call that extragenital testing.
Extragenital testing. Ooh. Okay. Well, make sure y'all look how to get that done. Go get tested. I got a story because it's a funny story. I told this before. But I told this in my, when I told my HIV story, when I had to go get my labs done. And my doctor was like, hey, let's go ahead and test you for anal cancer just to make sure. I'm like, wait, I'm like 23 years. But I went and got that done, and it was the most uncomfortable and most awkward thing.
Full of brush up in your butt.
The point of my story is, it's going to be awkward, but when that's over with and you have your results, you're able to talk to your provider and then kind of let them know why you felt awkward or why you may have felt a little bit deterred from actually getting a test done. And that creates sort of that relationship or that conversation and dialogue that you and your health provider need, which is part of the Getting to Zero action plan. Is creating that dialogue between community leaders, healthcare providers, peers, and just really understanding where we feel uncomfortable.
And it's community engagement is what it is. And it's not just folks like us looking to find our seat at the table, but it's those who are out there trying to create this plan and this strategy, finding a means to make sure that they're reaching us and letting us know that these tables and these rooms exist for us to be a part of. So often, we have these meetings Monday through Friday between 9 and 5. Well, most folks work Monday through Friday 9 to 5. But I find it easy because I get paid to sit at that table. Whereas someone who's maybe not engaged or not involved in an organization, they would have to take time off or try to find a ride, figure out how to
find a babysitter.
That's another important thing. Childcare, all these barriers.
Too.
Yes.
Can get out of my hand and just be like, all right, bitch. We just go talk about some of this.
We can cuss on here?
Oh yeah, we can. I probably should have. That's okay, because this is why I do this.
Strengthening representation and reducing structural and systemic is having safe spaces for special populations, for lack of a better word, to meet, to talk about our Getting to Zero strategy. So when we do some community engagement, there might be some trans populations that don't feel safe in a general setting. or in a certain community that a meeting's being held. So for our state planning group to have a special session that is really a closed group, after hours, that addresses and provides for a safe space, those are ways that we're looking to overcome a lot of the structural and institutional barriers to people participating in the strategy, as well as online and in person.
Yeah, I was gonna say, so would that say, like, are we working with different community groups that are already trying to create that space? Okay, cool.
By any means necessary.
By any means necessary. Within addressing barriers is support people with lived experience. It's goal 16. I didn't know this, but you PrEP and PEP can be prescribed to people as young as 12 years old. That's actually pretty impressive.
Well, keep in mind,
we're available.
Any minors 12 years old and up can access sexual health services in the state of Illinois. So of course that would need to be inclusive of PrEP and PEP. So 12 years old and up, you can seek sexual health services without parental consent in the state of Illinois. And I think that's important for people to know.
Exploring your curiosity, but safely.
Well, and most of the times, particularly minors think that they can't access these services because they may not have the ability to pay. But there are programs, grants, other means of maybe suppressing that information off of mom and dad's insurance. Or there might be a grant stream that can cover those services so that they don't have to come out of pocket. Particularly if you're looking at testing for sexually transmitted infections, getting medications for treatment or preventative such as PrEP. Those are all great things that I think minors need to become aware of, because when we look at the trends in HIV epidemic, largely what we're seeing among young people is high incidence of rates of transmission of HIV.
And that's why I think that's such a unique and key thing to have there, is because of those rates.
It also speaks to some of your structural and systemic barriers.
Really?
It's them not knowledge, knowing that these things are available.
So would you say that falls more on maybe the education within some of the systems? At least that's what I'm trying to assume, but it's like, even like when I went to my sex ed, I'm like, okay, did we talk about like sexual? Nope. We did not. And I'm like, okay, did that affect like my my behavior? Like, of course, my mom would be like, make sure you wrap it up and wear a condom because I ain't trying to take care of no kids, kind of thing. But like, we don't always have the other side of the conversation. As a Black family, we always advocate to use a condom to wrap it up so you don't have kids. But when it's turned on the other script, it's like don't have sex with men because you're going to contract HIV and you're going to die, kind of thing. I'm not saying it's that black and white.
No, but there are some kids being told that in the classroom. You mentioned sex ed. So in the state of Illinois, we have comprehensive sex education. So schools, if they're going to teach, they can teach abstinence, but they also have to include the comprehensive, medically accurate, age-appropriate piece of sex education.
Of course.
We do know that there are some jurisdictions still sticking to the abstinence-only approach to sex ed. It's against the law now, but we do want to encourage, if you are going to teach sex ed, teach comprehensive sex education. Most actual school districts are looking at both sides, not just a heteronormative narrative as we talk about comprehensive sex ed, but also starting to have curriculums that are inclusive of LGBT sex education. So that those populations feel a part of and included in that discussion moving forward, which helps to benefit and aid in reducing STIs, comfortability, and shame. Yes, a lot of that is placed on the parents. Parents do have to sign off and give consent to their students, their children to participate in that, but most are likely to do it.
I want my kids to like learn through my experience. Freak in the sheets. Hey. One of the actual goals within the action plan is to improve educational institutions by creating mentorships and hands-on education, through STI and HIV clinics. So I think that's such a huge, huge component, because when you look at the results of what it can look like if you provide a mentor, if you provide hands-on training, the results are beautiful. Like the results is like this, the results can be this action plan. There are a lot of people who are involved in it who may have had that mentorship, who have had that hands-on training. So in your experience, how do you kind of look at that strategy being a key piece within the action plan?
So I look at it from a couple of different approaches. One, on the clinical side, I think that there has to be education, understanding with relation to the cultural responsiveness to the patient population. So understanding the cultures, and I'm talking about racial, ethnic issues of the patients, populations that they serve. And that's actually across the board with all staff, and that's maybe what I should say. But also as a person of color coming into, meaning black, coming into an organization, I want to make sure that there's representation. People look like me. I think that's important to understand. And not just on the frontline staff. I'm talking about people as upper management, administration, throughout the whole process. I think that's going to be important moving forward. But down to the level of being a patient, client, consumer, whatever you want to call it, I think it's important for us to connect and talk to each other, because I think that we can help each other out with a lot of things that may be case management or, caseworkers, whatever. Doctors, nurses.
I can't go to this person because this doctor can help me the best. In your experience, who have you gone to, kind of thing? Like, how can you help me out in these different...
Which is where I think peer navigators, community health workers play a really important role. And it's also a social justice, and economic justice. And giving folks like us with lived experience,
paying it forward,
involved in the process so that we can help those coming up behind us. Because when we talk about terminal uniqueness again, I'm going to call you out as a peer. I'm going to say, why aren't you taking your medications? And if you start going down that road of something that I'm familiar with, I can probably talk to you a little bit different than a caseworker or a nurse could. Because I'm going to just flat out call you out.
Call you your bullshit.
Call her your bullshit.
That's true.
So, and I think that's helpful sometimes. Being straight up front with it. When you look at the trends of the epidemic right now, transmission and rates, largely black and Latino men who have sex with men, gay and bi men. Let's say that. Right next to that is African American women. So we really need to start looking at roles, cisgender, heterosexual, black women. We really need to start looking at some of that. And let's not forget our trans and gender nonconforming brothers and sisters in this process.
Yes, ma'am.
So representation, I really think is going to be key moving forward. Too often we've got organizations that are cisgender, heterosexual, white women. That demographic I think we need to look at to change to really start addressing the epidemic.
Another key thing was expand outreach, education, and marketing efforts was a goal for. And the strategy to this was to tailor support for potentially, and this was actually a unique strategy actually, now I remember when I was writing this down, was to tailor support for about 5,000 people seeking HIV services, sort of like creating resource hubs. In your experience, how would you practice that strategy within this plan?
Let me highlight what we're doing here at IPHA. Illinois Public Health
Great
Association.
example.
What we do is we actually have an MSM of color outreach prevention, social media training.
That bitch
So
is bad.
it's actually a training that you've been through. A couple
I've met some great people too.
It's a way to target certain campaigns towards specific populations. Ours is geared towards MSM, men who have sex with men, gay bi men. It can be adapted to any population really. But it's using the resources that are provided by the Centers for Disease Control and Prevention. One of the ones that we use is Let's Stop HIV Together. So, it's a campaign, it's got lots of materials, lots of tchotchkes, giveaways, things like that, but a lot of data. So if you're a provider out there that is providing PrEP, go to prepforillinois.com and sign up. Or if you're a patient that knows of a provider, encourage them to sign up at prepforillinois.com.
The action plan in regards to this portion, the PrEP and PEP, what I find is challenging and what I find will be really amazing to see as far as results is the challenging part is going to be in those rural communities, environments, because you can't really compare that to Chicago or maybe San Francisco where the environment is culturally different. Being out and embracing your sexuality in the open is a lot more accepting versus, if you're in Buku land or whatever, you know what I'm saying? Where,
Bukulia.
yeah, that's all I can think of. I'm not gonna like name a city because I ain't trying to throw nobody under the bus, but you know who you are, kind of thing. So like if it's not as welcoming and accepting, I feel like that's gonna be hard to push prep in those environments, especially because everybody knows everybody. Like, oh yeah, my sister's like the healthcare provider up at the health department. She told me such and such when I got this done, but I ain't about to tell nobody. But like, you know, word of mouth gossip, things happen. The goal 21 is to improve data system, and this will allow providers to more easily determine if individuals are in care or out of care by expanding timely access to surveillance data maintained by CDPH and IDPH. We live in a heavy digital age. Facebook has information, your digital fingerprint, basically. So you have your digital fingerprint. Stop DMing me. Oh my
seriously
God.
Trying to get
my attention. It's probably noon right now, so I get pushed
and
black.
You're in Springfield, so.
I don't know nobody out here.
Okay. That's your words, your story.
So
anyways.
And I'm sticking with it.
Increasing access to care. The CDC has what they call data to care. And it's actually an intervention that they use, which is aligned with surveillance, to track people in time, tracking people who have fallen out of care and are not linked to care. And it's timely because folks on the care side and prevention will get a notification that there are individuals that have fallen out of care, not linked into care. And I don't know if you know, but there's a term to what's called disease investigation specialists. They're actually folks that go out looking for you. And they use a lot of techniques and tactics to be able to locate you, find you, to get you linked back into care.
I don't know how I feel about that, though.
Well, I mean, it happens with most diseases. If you test positive, say, for example, like syphilis, tuberculosis, all those things, same thing happens. I mean, it's a public health issue, particularly if you're not getting treatment and you're not in care.
Well, I don't have an issue with that. I think not because it's a different disease or anything. I think my issue actually is, but when
now you're talking about something different.
Oh, so okay. Yeah. So
I thought we were talking about getting linked to care and increasing access to care.
Okay. Let me go ahead and bring it back. So you take off because I just went off.
I'm just trying to reel you back in.
Okay, all right. No, wait.
No, we can talk about it.
No. And the reason why I brought it up, and I don't want to get too offhand, too much. And the reason why I bring it up is because I think it's important that we are collecting data so that we can better assist people in high-risk populations and get them to the care that they need to. I just feel like at what point, since we live in such a digital age, I've seen that data in general, is very vulnerable. So that's why I'm like, there are things where it has pros and there are things where it has cons, but I think the point is we need to focus on the pros because right now, that's where we're at. That's what we have access to.
That's where I say, when you talked about the pros and the cons, that's where we need justice involved, sex workers, people who are using drugs, people who inject. We need those populations at the table. Those who feel threatened or compelled to participate because of laws and policies, be at the table.
Come at the table.
We don't know how it's impacting you or your lives or how it's going to play out unless you're at the table and you really advocate for it. Yeah. That's where the activism and causes like HIV have really kind of evolved. I mean, you look at where HIV has brought the FDA. I mean, had it not been for HIV and ACT UP, approval of medications was put on a rapid list through the FDA, and that was largely due from HIV activism, ACT UP, for medications to be rolled out. Most organizations have a medical benefits counselor or a manager that can help you navigate your health insurance and understanding and overcoming a lot of health literacy. Also trying to hook you up with other places, specialty care. And understanding, I think a lot of people, particularly those of us living with HIV, need to recognize the importance of having a primary care physician. Not just an HIV specialty care physician, but having a primary care physician. Your HIV specialty care is only looking at a few things. Your primary care is looking from head to toe, mental health, all of it.
All of it, So I got a crank in my leg, like my specialty doctor, ain't gonna be like, okay, you probably should go to your primary doctor.
And finding public health entities that might be specific culturally to some of your needs.
Yeah.
You know, so just thinking out of the box a little bit. I think it's always good to have folks who can be a point person to help you access that. Largely, that's your case manager. So definitely speak to your case manager, caseworker, your peer navigator, your community health worker on what are some of those resources.
That's actually all the questions that I have today. Did you have anything that you want to touch on or we want to say to my audience?
GTZ-Illinois.hiv.
Get it done.
PrepForIllinois.com.
Keep it going.
HIVCareConnect.com.
Okay.
And of course, my favorite, IPHA.com.
All right, y'all heard the man. He gave you four in there throughout this video.
Check us out.
But before I go, I want to thank you guys for joining this conversation and just watching us just interact, be some clowns, and of course talk about information. If you haven't already, again, subscribe to my channel. Follow me on Instagram and Facebook. This is Dusty Lion and Hopeful and Victory Talks. You guys have a great rest of your day.
Good night.
Bye.